Hello, everybody, and welcome to another podcast of Advocacy. Thank you all so much for joining us, and we apologize. We are a few minutes late, having technical difficulties with the platform, but nonetheless, we are here. I am here with my um, c- co-host, I guess, or host of the mostest. Paula is here, and then we have Aaron who is joining us. Aaron is a nurse practitioner with the Department of Neurology, and she is going to join us by delivering at talking to us about delivering exceptional care. So, Aaron, you have the floor. Tell us all about the services that you provide.
Hello. Well, first of all, thank you all for having me here tonight. It's really a pleasure to be invited to join you on the podcast. I think for a wonderful calls. I think it's great that you guys do this for autism, for people with disabilities. I think it's absolutely fabulous that you created this podcast. So I just wanted to thank you for inviting me on. I really appreciate it. I am with the University of Maryland Medical School and I work in the Department of Neurology. I work with Dr. Peter Crino, who put together a clinic for the state of Maryland and for University of Maryland Medical School. It's called the Clinical Center for Adults with Neurodevelopmental Disorders. And we take care of adults with autism, which it's a really cool center because it was created probably about 4 or 5 years ago. I didn't join until recently. But there are a lot of services for children with autism in the state of Maryland as far as neurology goes, as far as early intervention services. However, for adults with autism, we don't typically see a lot of places where they serve the adult population. So we have a very unique clinic. We want to create comprehensive care. So we have recently had, we did have a psychiatrist on staff 1 day a week, but we recently have had a new social worker join us. We've had, we have a psychiatric nurse practitioner, which is myself, and I'm there 4 days a week. And then we also have a uh, neuro nurse practitioner that works under Dr. Crino. And we all work together at the center to create collaborative treatment for adults with disabilities. We do genetic testing. We also provide, I'm sorry. Sorry, I lost my train of thought. Anyway, so I want to ask what you guys have as far as questions. So, we really treat adults with autism, epilepsy, and intellectual disabilities. I'm really excited to join the team. I'm excited to be here. And I want to know what you guys have questions as far as what we do at the center first. I'd like to.
Well, one thing I will say is I did meet Aaron um, when I brought Morgan in. Morgan is transitioning from pediatric services to adult services. And I will say that when I walked in, I was just excited because they had a team of people. And I myself, in the past, I would have gotten intimidated by something like that. But for me, it was such a good feeling because I feel like they came together. Everybody had a different role, but the roles came together to make like a big summary of Morgan. So, number one, I will say that I felt great because I felt like they considered me a vital part of the team. And anybody that listens to the podcast knows that I put major emphasis on you as the parent being an advocate. But there are some doctors that sometimes diminish your role. So for me, I was so happy because they made me feel as though I was an expert with Morgan, which I am, but they listened to me. And so when we came in, they had a genetics doctor. They had
Right.
Dr. Aaron. Yeah, they had Dr. Crino. I mean, he was so down to earth. I mean, Morgan was at her worst. Anybody that knows Morgan, she has bad behavior when she's around people that she's not familiar with, but they were patient, they were knowledgeable, they were um, they were eager to learn about Morgan and put, you know, their book knowledge to specifically Morgan. They didn't lump her into everything. I helped them to understand Morgan. They helped me to understand Morgan. And I think we put our information together. And I walked away with such a great understanding and such a hope of learning more about Morgan. So I will say I would recommend them to anybody. And the drive for me is an hour to an hour and a half, but it was worth it. It was worth it. So I do want to say thank you, Erin, for you guys just making me feel so special and making me feel like Morgan. They took like I think y'all we stayed there like an hour and 15 minutes. I was like, oh, this is great. Um, so what I want to start off with, Aaron, is when you have a patient that transitions over from the pediatric side to the
Yes.
adult side,
Mhm.
tell us what that team looks like or what's your plan of action to kind of transition them over and get to know them.
Okay. Well, usually they meet with Dr. Carino first, and Dr. Carino looks at their medical history and takes a look at, like I said, we treat epilepsy, autism, and intellectual disability all together as one. Dr. Carino also treats TSC, but we usually take a look at their medical history.
What's TSC?
I'm sorry. So that's another complex. It's another type of disorder that goes along with epilepsy. So I apologize. It's not. Yeah. I'm speaking in those little medical lingo stuff they tell you never to do, right? We take a look at their medical history, and usually what we find in adults with autism and neurodevelopmental disabilities is we find that they don't have updated genetic testing. We find that very often. So we look back, and if you look back 20 some years ago, when they offered genetic testing to individuals with autism, they might say to you, let's check you and see if you have Fragile X, or let's check for one gene. They don't really look at, they didn't really look at extensive genetics. So, what we do when we bring you into the clinic is we take a look and see if you need that updated genetic testing. We go ahead and we have a genetic counselor that talks to you. We go ahead and develop a plan as far as your epilepsy. And sometimes the results from our genetic tests will sometimes guide us in how we treat patients. So that's the benefits of the genetic testing. It might let us know what types of what types of medications might work for you as far as seizure control. So that's a very helpful information. Also, sometimes with the genetic mutations that we may find other health problems that exist with some of the mutations. So it's very important that we revisit this. I'm coming from a personal aspect. I have a son with epilepsy, autism, and intellectual disability. And I know, like many parents, I was brought on to a team of people when he was young, and they gave me the little slip of paper and said, we're going to check for a few things. Um, and that was it. And I never got guidance from anyone else about genetic testing until I transitioned him from pediatric care to adult care. So the benefit, like I said, of seeing Dr. Crino is we get all that genetic testing. You get to speak to a genetic counselor. Treatment is given to you for your epilepsy. We have a social worker on our team that joined us recently. She joined about the same time I did, about 5 months ago or so. And she's there to provide support for help with DDA services, to help guide you as far as if you need respite care, things like that. There's a lot of complicated things that come into play when you transition from pediatric care to adult care as far as the services that are provided. People start to think about whether they need a power of attorney, whether they need, a proxy. So a lot of people like to connect with our social worker for those services. And then I come on to help provide behavior support and to also provide psychiatric care. So our patients really appreciate that. A lot of our individuals, as they grow to become adults, they may have challenges as far as anxiety, depression. Some of their behaviors may be related to stuff that everybody who's neurotypical goes through. And I think sometimes, when people provide psychiatric care to individuals with intellectual disability and autism, they forget that, neurotypical people have problems with anxiety and depression, and so do people that are not neurotypical. And I think we forget to treat the patient and treat who the person is, and not necessarily treat autism when we look at the care. We like to look at it from a holistic approach, and we like to make sure that we're looking at the challenges the individual faces. And I think people forget that, in psychiatry. I think they treat the disorder, and we see a lot of people not understanding autism, not understanding individuals with intellectual disabilities. I think one of the benefits of Dr. Crino, as far as this team that he created that is amazing, is he's constantly trying to hire people and get people to join the team that are very, very educated in autism and people with intellectual disabilities. So not only do we provide care in our individual fields, but we also bring to the table, we might have some expert experience in this field. So when it comes to autism, we're much more educated about it. Whereas in the general population with professionals, sometimes you don't always see that.
And that's one thing that I like that you said, that you guys are well educated in that area.
Mhm.
One thing, and you touched on it a little bit. I wanted to ask the question, and is piggybacking off of what Paula asked, with regards to transitioning from um, you know childhood
Mhm.
care to adult care. What are the most differences that you see in autistic children? My grandson is autistic. So,
Mhm.
is it that I know you said that sometimes you see the behavior issues, but what are some of the differences as they grow up and they transition over to adult care? What are some of the differences that you're seeing?
Well, first of all, you usually, as an adult, deal with many more medical comorbidities. You may
Oh,
have issues related to the heart. You may have hypertension. You may have other types of medical challenges that, diabetes type 2, that adults face, that typically the children, don't face in large numbers. So that's one thing that, we see. Another thing that we see is, when our children transition into the teenage world, the adolescent world, we always
hmm.
say there's this huge, um, they have to adapt and they have to figure out how to deal with the transition. But I think when you become an adult and you become more independent, some people with autism and intellectual disabilities need to learn to hold a job, need to learn to live independently. These are goals that some of the parents have for them or they have for themselves, and they've
Hmm.
got to learn to adapt to that. It's a new transition for them. So I think it's just like a 18-year-old going off to college. I mean, if you
Okay.
think of it that way, it's any neurotypical kid going off to college. It's another transition that we forget. We look at individuals with disabilities sometimes and we make judgments. Oh, it's the disability. Oh, it's the disability. They can't always express what's going on. So when they're transitioning in life, they need a lot of support. So we find as adults, there's these transitions that they go through that children don't necessarily go through except as adolescents.
Yeah, because I was wondering, and they start at the age of 18, or is a little older when they transition over to your care.
No, they start at 18. So
So I guess to
mhm.
ask another a part two to that question,
Mhm.
Is it testing that you guys would do? If I was to bring my grandson there, he's turned 18, I'm transitioning him to now adult care.
Mhm.
What would be the care that you would give, the assessment that you would give to a new patient that's transitioning to adult care? What does that look like? The assessments and testing and all of that.
Well, like I said, Dr. Crino would lead the team as far as what he feels is necessary from a medication standpoint. He'd see if there's a reason to do and run any medical tests as far as a CAT scan or a MRI. To look at if the adult is still having seizures. If the seizures are controlled, not controlled, they would tailor the treatment based on that. And then, like I said, you would connect with the social worker if you have a need for those services. If you have a need for psychiatric care, you would connect with me. Um, so those sorts of things. And then the genetic counselor would come in. If you have not had testing, it's probably something that Dr. Crino would recommend.
Okay, good to
Now,
know.
Aaron, if
Yeah.
it's so important for genetic testing, I was a little surprised because Morgan does have a rare genetic disorder,
Hmm.
but that was found out when she was first born.
Hmm.
If this is so important because, as you say, things change over time, why is that something that is not done until they come to the adult clinic? Why is that not something done over time? Just as things change, and especially with us,
Hmm.
Morgan's been a mystery to me for 20 years. The more information that I get, the more that I can get to know her, and especially when it's a simple swab of the cheek. Why is that something that they do not continue to do like every so often?
Right. And I think in our clinic, certainly that will be something that's revisited because we find more and more gene mutations. We find out,
Mhm, mhm,
more about different syndromes, different disorders. So I think that, that's a good question. I think part of that could be that, right now genetic testing is still fairly expensive. So
mm,
I think that that's probably a big factor. The other factor is probably also that there's some miscommunication when you're transitioning.
mhm,
As you do that testing and you go through, this transition. I don't know if there's necessarily preparation that's put in
mm,
place. We're still discovering a lot of this stuff, so I don't
mhm,
know if there's an exact timeline for it. But
okay.
I think that cost is a big factor because the genetic testing can get very expensive.
It's really unfortunate though, because like I said, one of the things that they did say was, "Hey, let's test Morgan." And I'm like, "Well, she was tested from birth." I'm thinking that was it. But, to get her tested because like you say, things change all the time. And I think that is so important because as you say, as she's growing, and I feel like not saying that she's the only one that should be tested. I mean, of course,
Mhm.
things change with us. You get the aches and the pains and everything,
Right.
and sometimes you don't realize that a lot of times from a genetic standpoint, those are things that's being passed down through, your bloodline. So I do think genetics testing is so important. Another thing that I wanted to ask is as far as the behavioral side,
Mhm.
I know when I talked to you guys about Morgan's behavior, one of the things that I was apprehensive about was putting her on medication. And I think a lot of parents, when they think about their special needs individuals, although it's a great way for them to express themselves, how do you kind of, talk to the parents when they are like apprehensive about putting them on medication?
Okay, so I think that one thing to remember, and I'm gonna give you a little bit of history if you don't
Mm,
mind.
okay.
So I think I said that I'm a parent of an adult with autism.
Hmm.
So I've been through this process. I've been through this journey. So um, I try to really take a look at each patient, and I look at Um, if I was the parent, what would I do?
I like
I
that.
might not, I might recommend medications, but I might say to myself, what would I do in this situation to minimize any risks when we
Mhm,
use medications, but to use medication to alleviate other risk factors?
mhm,
So, for instance, anxiety and stress could contribute to seizures. We don't know a lot.
mhm,
I'm in the psychiatry world, not necessarily a neurologist. I don't, but I do know that anxiety and stress, they do know, can contribute to seizures. So you gotta weigh. You have to weigh sometimes. You also have to know, is the anxiety causing the patient to not be able to function? Like, are they not able to leave their house? Are they not able to do anything socially? How impaired you know, is the patient. So I think when I talk to the parents, I try to weigh the risks and the benefits. If you have self-injurious behavior to the point where somebody is going to smash their head against glass, and they're going to hurt themselves, you have to think like a parent. You have to think,
mhm,
on one end, you got, you know, somebody here that you're going to give a medication and they might be more sensitive to side effects, and things like that. And you got to think about, some of the medications cause weight gain. And you have individuals that might not necessarily understand exactly what the medications do. So you have all of that. And then you've got somebody that can get hurt on the other side. So
mhm,
I like to think of it as a way to talk to the parents. I want you to weigh the risks and benefits and see, is it really something that's worth, risking these side effects? If somebody is going to bash their head and wind up with a head injury and winds up in the hospital, I think the side effects from a drug that may cause nausea, may cause a little weight gain, that might be something to really visit.
mhm.
But if you're going to put a patient on a drug that, say, may cause long term blood sugar issues or diabetes, and you're trying to stop a patient from climbing in, the bathtub at night and sitting there and refusing to get out, that might not be a reason to put someone on medication. So I
Okay.
try to really put myself in the shoes of parents and try to say to them, look, weigh the benefits and risk. And I think about, if this was my kid or this was my child, they're adults, but they're always your children.
Mm.
What would I do? You know? And I don't mean from a personal standpoint as far as being biased. I just mean looking through the lens and trying to figure out if it's something that's worth taking any risks.
I like that approach. And I will say that you have done that with me. We've had extensive conversations. And, I will say that I love the fact that they started at the bottom before they go to the top. And I will say that they definitely listen to me as a parent. Now, I would say too, Aaron, how do you guys deal with the parents that are not so educated or not so knowledgeable about their kids when they come in? What type of approach do you take to help them to kind of understand? Because some parents still, and I will say this for me, in some areas for Morgan, I'm still clueless. So, how do you all work with the parents as a team to make sure that that parent understands and the treatment that you guys are suggesting for their special needs individual?
Well, I think the main thing is you gotta, you kind of gotta educate people in different ways depending on how you think they're gonna learn. Um, my background and how I got into this, I was a special education teacher for years. I went back to school when my son was diagnosed with autism, and I became a special education teacher so that I could learn, I could teach him, and I could give back at the same time.
Oh, I love
So
that,
I
Aaron.
love it. I didn't know that about you, Erin. I'm learning more and more about you.
So for 10 years, I worked in the school system, in an autism program and in a program for students with intellectual disabilities. So I have a unique experience in, I guess, educating parents probably and families, because I understand unique learning needs. So it's easier for me to really get in the head of someone and how somebody might be thinking. Um, they teach special educators that it is a gift, but um, so I did that for a while and became a special ed department chair. So through those years, I learned a lot. And I really do think you have to tailor, if you talk to a nurse, you can probably tailor your education and say things, you can use your medical lingo, you can um, do all of those things, and a nurse will understand. But if somebody doesn't believe in medication, has never even heard of half the medications you're talking about, you might have to take out a book. Sometimes I take out a book and I say to my parents, or I say to my patients that I treat in the epilepsy clinic, I say, this is the medication. This is what the protocol is for it, or this is what the standard use is. And I kind of show them and guide them and say, I'm not just going on something from my own head. I'm actually looking at the book. And people learn in different ways. So sometimes I'll do that if I think somebody is kind of tuning me out and doesn't see where I'm going with things.
Mhm.
Um, I might pull out that little block, the medication and the side effects, and say, this is my book. This
That
is
would be me. I would be that parent. I'm like, I'm visual. I need to see. Let me read. Read it to me. I am that parent.
Mhm.
so yeah, so I think that it's an advantage that I worked in special ed, that I'm able to kind of assess people's needs and really, be able to figure out what people need, and what they need to be educated on things.
So
Sorry, I
what?
have a son with autism that just came to me and asked me to help him
This
with
is
his
And it's
real life.
okay. We would
We do
love
this.
to meet him. Will
Yes,
is he
yes.
comfortable to come on screen?
He just ran out of the room.
That's
He
the
just,
Morgan. We do this all the time. This is real life.
"Scott,
It's
This,
come
real
here.
life. It's
Come
real life
say
for
hi.
us.
I want you to say hi.
If
Come
we
here.
can steal away for an hour without interruption, it's really good.
hey,
Hello. What's his name?
Hi.
hey, Jack. Is that your son's name? Is Jack?
Josh.
Oh,
Josh.
Josh.
Hey, Josh.
Josh.
Yes, his name is Josh. He is nonverbal. Um,
Okay.
he's really good. We've been through some moments though.
Mhm.
Um,
Okay.
so I think being able to put yourself in somebody else's shoes, whew,
Mhm.
that is a benefit.
It
You know
is.
how people say when you come there, they're like, "You don't know what I'm dealing with." I'm like, "Oh
You be
yes,
like,
I do."
Oh,
I
you
do.
know, you
I
know,
do.
you know.
And
Now,
that's
Aaron,
one
Um,
let,
thing.
yeah.
That's
let
one thing I could say that I identified with Erin. We talked because I felt like she was a mom like me. And when she told me about her son, I'm more inclined to really sit and
because you
get
can
comfortable
relate.
with her
You
and
can
receive
relate.
what she has to say because I'm like, first of all, you've already crossed that bridge. So let me get some information from you because you've been there. So let me just, because I'm coming over that bridge, but you
Yeah.
went before me. So,
How old is Josh?
He is 22.
yeah.
Okay. So let me
Mhm.
ask a question. You said Josh is autistic as well as he have epileptic seizures.
Mhm.
Now, with him being nonverbal, how did you learn the cues or watching him to try to get ahead of the seizure or to be there to help him through that? Because
There's
I'm
no
sure that could have been challenging.
There's no warning. I got no warning, and actually, his first seizure was during the pandemic. We were sitting at the
Mhm.
dinner table, and he just had his first seizure. And I tell you, I worked as an emergency room nurse, and this emergency room nurse was panicked.
Wow.
I was a mess. I would jump in right away if my nursing skills were needed. But luckily, my husband is a first responder, so his stepfather was able to jump in quickly and provide care and turned him on his side. And he did stop breathing the first time, so it was a very very scary experience. And my
Oh,
husband was
wow.
going to start CPR, which just
Oh
it
my
awful.
goodness.
Oh my
Um,
Lord.
so, you know, my heart goes out to these parents. I mean, I have the utmost respect for the individuals that have, that have children like this and
Mhm.
with these challenges. So yeah, so I don't think you're ever prepared for the seizure. Luckily, he did well with it, and luckily, we found Dr. Carino. Thank.
Okay.
Um,
Wow.
but I went back to school after I left special education. I got out of it, not because I didn't love it. I did. I loved being a department chair. I worked in Baltimore County for years, and I absolutely adored it. But I left so I could come back to be a nurse, and I could work with the medical needs, and deal more with the psychiatric aspect. So I was really just furthering my education.
Mhm.
But look at all that education I have and all that medical experience, and nothing prepares you for that
Mhm.
moment, being a mother and seeing that. Um, so I just think, it's really cool to have a unique perspective as a nurse practitioner and to deal with this because I literally can put myself in people's shoes.
Mm.
But I also saw things in the classroom for years, that
Mhm.
also gives me a little bit of an advantage. Um, so yeah, I don't think you're ever prepared, and there's not much you can do other than decrease stress with seizures, make sure
Mhm.
they take their medication, and make sure you're giving them the best medical care possible, which is why the genetic testing is important as well.
I,
Okay.
I totally agree with that. Now, how I know with Morgan, and I'm sure you guys can attest to this, what I dealt with when she was 3 is not the same thing I dealt with when she was 6.
Right.
What I'm dealing with when she was 6 is not anything like I'm dealing with when she's 20. Does that psychiatric I hear a lot when they will talk about the psychiatric side for Morgan. I kinda in our communities, that's not something that we really talked about
Right.
or that we, promoted. When you talk about that, how does that factor into the kids constantly growing and evolving? Because when I hear the psychiatric side, I guess I downplay it because Morgan is autistic, but I also think about what you're saying. It's like she's a person before she's autistic. Yeah, but I think when you hear that psychiatric side, can you talk more about that as far as parents? Because again, in our communities, we just and Bunny, you would know, do you? We don't really talk about that.
I was going to ask the question, what is the difference from what you do as a psychiatric nurse versus another nurse that specializes in autistic needs? I was going to ask that question.
Mhm.
As far as what's the difference between a medical nurse practitioner and a psychiatric nurse practitioner?
Pretty much, yeah.
Okay.
Mhm.
So we have like Dr. Carino is absolutely amazing in the way he finds people. I don't know how he does it. But our neurology nurse practitioner, she worked at Kennedy Krieger and she's absolutely wonderful. She's so good with the adults with autism. And she has all this knowledge of autism. So obviously she's a medical expert and she has all the background in autism. So as far as that goes, she kind of deals more with the epilepsy and what triggers the seizures, the medication for the seizures, helping interpret test results as far as the CT scans or the MRIs. What I do is I take a look at the mental health and I see, does this individual have anxiety? Does this individual have depression? Do they have self harm where they may bang their head or hurt themselves? Do they have suicidal thoughts? And then I will go through and treat the patient as far as psychiatric medications go. So does that answer your question?
Uh, yeah, Paula, you wanna add to it?
Yeah, I do want to say, how do you identify depression and like suicidal
Suicidal.
thoughts with a nonverbal individual? What are some of your key signs?
So this is what's interesting. I have not been working in this kind of position for years. I'm not a 20-year veteran of psychiatry, but I will tell you this. if you don't understand the autism population and you don't know how to interpret body language and you don't know how to read people because people can't communicate well, you're not going to pick up on those signals, no matter how good of a psychiatrist you are.
Mm.
Which is why I think Dr. Crino is so smart because he gets people that have a background in autism that know their field
He's a
first.
whisperer of the of autistic people.
Yeah, I think he understands that if you don't get this, you're gonna miss everything. You're not even gonna be a good, you know, a good medical provider if you don't understand. So I'm not saying that I necessarily have the answers or would be able to recognize the signs, but I bet you that I might be able to recognize those signs quicker than somebody that has no experience with autism, intellectual disabilities, anything like that. But we do look for regular signs of depression. Like, I mean, you might see a patient not eating. You might see someone
Mm.
in their room not wanting to come out, not wanting to do things, not smiling a lot, not enjoying things they used to enjoy, withdrawing from people. Um, you have to look for those signs. It's interesting because I treat, epilepsy patients as well in the clinic, and I have people come into my office or come into my clinic and they say, "Yeah, I'm here because I'm crazy." I'm like, "What? You're crazy." They're like, "Yeah, I have anxiety and depression." I'm like, "That does not make you crazy."
Oh
If
my
that's all
goodness.
of us sometimes.
Right.
Right. It's so funny that
So,
you say that we've got to pay attention to them because with my grandson, you're right. When he withdraws or he doesn't want to be bothered, he's just off to the side, there's something wrong. We kind of
Mhm.
recognize that when Grayson does certain things, there's something wrong with him. So I definitely understand you saying that you've got to watch them if things change, if they withdraw, if they don't want to eat, if they don't want to be bothered. I definitely get that. I definitely get that because Grayson, we'll see that in him, and me and my husband will look. We like something is wrong, and then
right,
we'll start trying to investigate, try to figure out what's wrong as best as we can. Sometimes we never figure it out, but definitely we do see the difference when something is wrong.
right. And if you
Mhm.
think about the challenges individuals with neurodevelopmental disorders face, you think about they got to navigate a world that does not cater to them.
Yeah.
And
Mhm.
they have to adjust to people not being able to understand what they want all the time.
Mhm.
You can't communicate your needs all the time. That alone is anxiety provoking. I don't
Yeah.
care. I don't care about
Mhm.
who you are, your disability, what it's anxiety provoking. Like, just to not be understood, and to not always be accepted. So I
Yeah.
think that in itself makes you more vulnerable to things like anxiety and depression. So typically, when I do see individuals with autism or neurodevelopmental disorders, I am very, very careful that I don't overlook treating anxiety and not just saying they're aggressive, their mood's awful, they're bipolar, I really try to see, are they anxious and depressed?
Wow.
Okay.
Wow.
Because the population in general, the general population, think about what you see the most in the general population.
Mhm.
We all become depressed, we become anxious
Yeah.
to different degrees. So that is something I really try to really look at with these patients.
I never really looked at Grayson. I'll speak to Grayson. I never really looked at him and factored in depression.
Mhm.
I never really looked at it that he could like during the pandemic. I he could have been depressed. It could have been a lot going
Mhm.
on with him with not being able to go to school anymore and not seeing a therapist and being able to just get out. I'm sure a lot of these kiddos suffer with depression and
Mhm.
grandmas like me, we just did not pick up that it would be classified as depression or,
Mhm.
with their behavior that they were having these challenges, we just called it being aggressive and
Mhm.
having social behaviors and things like that. But that's interesting that you said that, you do look at, is this depression or anxiety?
Right.
Wow.
And I think, aggression is serious and you do need to
Mhm.
weigh risks and benefits as far as aggression. But aggression also can be, escalating due to the underlying issues. So you have to
Issue.
think to
Mhm.
yourself, is this aggression really that this patient is out of control and this patient is raging and this, or is it this a patient who had untreated anxiety and is now
Mhm.
so escalated that they can't calm themselves down? And if that's the case, sometimes you would recommend treating them with a more aggressive medication, but maybe you would also treat them with an antidepressant or something a little less potent, where you maybe could take away the heavier duty med once the aggression calmed down and see if maybe the behavior improves.
Well,
I just
I will say this real quick. I know with during the pandemic, I think a lot happened in most households. In my household, Morgan was taking, I think it was Zoloft, I want to say. I can't remember. But Morgan is always a happy-go-lucky person. Our house is her kingdom. He was just always a happy person. I saw depression and it broke my heart because the more they increased the medication, Morgan sat on her bed and cried all day. And my son was like, "Mom, it's something wrong with her. This is not her." I mean, y'all, we could just look at her and she would just cry. And I will say that part of that is you knowing your child, you knowing your individual, and then I think too, working in concert with the doctor because I'm the type of person that's always observing her. And when I see something, I'm like, well, I'm like you, Bunny, something is not right. And I mean, when I say this went drastic, it was so drastic. And then there was another time I took her off that medication. They had me take her off. But
Sometimes people don't do well on certain medications.
But there was another time that we had her on, it was more from a holistic side, and they had her on some medication. And me and my husband saw a drastic change in her. And I took her to one of the University of Maryland doctors. I will never forget that the lady was so nice. I think she made it's like she came in there with baked cookies, but she was that sweet. And she told me, I was just like, tell me what's going on with my daughter. She said she's depressed. Y'all, I don't know who was more depressed than her. I sat in there, she had her students in there. I sat in there and cried like a baby because I always felt like I'm her protector, and if nothing else, I'm supposed to protect her mentally, physically, everything. And I just felt so defeated. And I will say that when we traced it back, my husband, I'm crying the whole day and just crying and crying. But after the tears, I was like, okay, pinpoint what's going on. And me and my husband put our heads together and he was like, we looked up the side effects for this natural medication. Side effects was down spirit. Once we took her off of that, she went back to normal. So I say that to say that even when you're working with a doctor and you are having them on some medications, you as the parent, you are the one that's observing them every day. You make sure you take them notes. You make sure that you document the changes with them so that you can work in concert with the doctors to find just what they need. So I was that was very there was 2 breaking points when I was just like, I really thank God that I knew my daughter. I did.
Yeah. Yeah, and I say that to the parents at the clinic. I mean, I will say quite often, I know you'll call me. I know you'll call me if there's any concerning side effects. So they always say to me, well, what if we get bad side effects? I'm like, you'll call me and we'll take the patient off the medication. That's the way it goes in the clinic. I think parents of children with disabilities are typically very, very in tune with their kids.
Yeah.
And I typically find they are more likely to notice side effects of medications than parents of typical kids, sometimes because they do observe for those things. But sometimes with medications it's a trial and error. But like I said, I think you always need to weigh, what are the risk factors here? If an individual is so upset that they can't go out of their house ever, and you're worried about using a medication, their life is going to be severely affected. They could wind up with major health stuff. They could, if they can't leave their home ever, because they're so impaired. So you have to think about those things. But I think I have a lot of trust in my parents. I typically find that when I start them on a new medication, they know if there's side effects. They know if it's not working. They know these things. And they come to me and say, this didn't work. I said, well, then we just take you off of it. We're not going to keep you on something you think is not agreeing with, your child. We're not going to do it. So.
Let me ask you about medication. What things do you guys try prior to medication? Is medication like the last resort, or how does that work?
Yeah, so usually when they come to the clinic, families come to the clinic. We meet as a team, Dr. Crino and the social worker and myself, um, and we talk with the family and we find out what are the needs, what are the behavioral health needs. Have you connected with DDA? Do you have a behavior plan? Do you have a behavior therapist? Um, and I'm always recommending therapy. If someone can participate in therapy, I think it's absolutely wonderful. I do find that some of the patients are not able to actively participate in therapy, which makes it more difficult because that option is hard. It's very difficult to find a therapist that will do CBT techniques or therapy techniques with a patient with intellectual disability and a patient who's nonverbal. So it's very tough. But most of the parents that come to the clinic that actually need psychiatric evaluations for their adult children with autism um, they're at their last resort,
Okay.
a lot
Okay.
of the patients. So,
Okay.
it's not that we can't do the evaluation. And I do have some parents that choose not to do medications, but a lot of the families come in and a lot of the patients are already on some psychiatric medications.
Mhm.
Got it. Okay.
Now, Aaron, I still hear you keep talking about the DDA. Can you explain that to our listeners?
Yes. So, there the services that you can receive from DDA. As a child, I know with autism, there's the autism waiver that I'm
Mhm.
sure all of you are familiar with. Um, a lot of patients get autism waiver services, and then as an adult, you prepare to transition into DDA services. DDA services can provide either self-directed services as you become adult, which is where you kind of control the program and you figure out what your adult child needs, and you hire staff and you can do all that stuff with your adult child. And then you have the traditional program, which may include a day program that the adult child can go to, and everything's kind of laid out for you already. The supports are already there. You don't really have to do a budget. You don't have to hire your own people, that kind of stuff. So the DDA is there to support you. Unfortunately, there has been instances where the school system has failed some individuals, and they were not transitioned properly into DDA services as an adult when they left the school system. And now you may see an adult who is 40 some years old that has no DDA services, no
Mm.
family has no support. And we do see that, and it's very difficult to watch as a provider. I and a parent. I'm like, I don't understand how people do it with no support. Um, so these individuals. This is where our wonderful social worker, who also has tons of experience with autism, and I know has done has worked as a technician, has worked in different areas in the field. And she tries to help to assist to get people to apply for DDA, to get them services. I know when you reach a certain age, you can't always get services right away. But if you have aging parents, you are extremely aggressive or you have medical conditions, sometimes they will bump you up on the list and you get services quicker. But this is why Dr. Carino emphasizes a comprehensive team at our center, because we see things like this, and this is where they're able to connect with the social worker, and the social worker may be able to, make sure they understand how to apply for DDA services.
And applying for DDA services happen at the age of 18?
Yeah, well, 21 when you transition out of
21.
the school
Okay. Okay.
for most individuals with intellectual disabilities. And
Well,
typically,
I will say that Morgan got approved when she was about 8. She was approved, but they, like you say, they didn't kick in until she's 21. So a
right,
lot of people end up, because there's a wait list, and that's why I tell people all the time, if you have a social worker. Morgan really didn't get any services until she was 18, but she had a great social worker. So if you have a social worker, please contact them to find out how you get on that DDA waiver, because once they turn 21, a lot of those services kick in, like Erin says. And if you don't, the
right,
wrong thing to do is to get on a list. Try to start applying for DDA when you turn 21. Number one, they got to classify you. They classify you for support only, which
mhm,
means you may just need help. Just
right,
finding I mean, you're basically can get a job and everything. So you just may need support. Then there are some, like Morgan needs the full service because she's going to need someone to help take care of her the rest of her life. So I don't know how many classifications it is, Aaron. I just knew of those two, but I don't know if there's any more.
yeah, there's different levels of supports. But one thing that's really important to emphasize, you have an IEP team for a reason.
Hmm.
Um, so just make sure as you transition, if you do have a child that's leaving the school system, especially, but even at 17, 18, bring these things up.
Yeah.
Do I have everything in place I need for DDA? Another thing that's important is applying for the Social
Hmm.
Security when they turn 18.
Yes, great
Um,
point.
it's so important. And I will tell you, Josh's father is a partner in a tax firm, and I've got the education I have. And applying for Social Security was the worst thing ever. It was so hard to
Yeah.
understand. It was
Hmm.
so difficult. And
Yeah.
we were in the middle of the pandemic when Josh was, in transition from
Hmm.
high school, to the transition program. And we missed out on a lot of workshops and a lot of things like that wound up being online that we just didn't really keep in up with. And if you don't get in those things right away, it's difficult.
Yeah. Yeah.
But let people know that, use your resources, use your school systems, use a team like we have at our center where we have a
Mhm.
social worker. Use your resources wisely. Really
Mhm.
reach out to those people that may be able to help you. Am I doing everything I'm supposed to be doing? I signed up with DDA years ago. I did the check mark. Do I have services waiting for me when they get out of school? That's something really important that people need to. They just need to keep asking questions.
Yes.
Yeah, this is good to know.
Yeah, and I know for
Absolutely.
me, a lot of the times, like you say, Aaron, you have to have those. I know talking to other parents, this is what advocacy is about, making sure that we're advising people, because sometimes you won't know to ask the questions if you don't have a knowledgeable team. And I will say, not early on, Morgan did not have a knowledgeable team. I was feeling my way in the dark, but I did say this. I got with the people that seemed very knowledgeable and I drained their brain. I found out everything. So, yeah, I did. I mean, and then I talked to other parents again that were ahead of me so that I could get that information. I'm like, well, how did your kid do this? Oh, did you know about this? Because some things you just didn't find out. If you got a team, as we know, when you're in the schools, everybody doesn't have a great team. And
Right.
so sometimes you don't know. Get with these other parents that's ahead of you and find out.
Right.
Find out.
Let
No,
me let me make a list. Get with parents that are ahead of you. Check.
Yeah,
I'm
Check.
checking that off my list because I'm talking to the two of you.
Yeah, it's the truth.
it is.
I
Absolutely.
made
Yes.
friends with everybody. As you know, Erin, me and you,
I
everywhere I went, I made friends with people and I asked them every possible question I can think of. I just did. And
yeah.
Important. Yes.
it helps you to get to know your kids better.
Yeah, you got to remember what you should have, you remember from school when the teachers used to tell you, no question is dumb, no
Yeah.
question is dumb.
And,
Absolutely.
that's
No,
important.
I have expertise in the field of special education, and I have expertise in autism and psychiatry, and I still ask questions.
But you are a great, with all of that under your belt, you are the best resource
Yeah.
for so many questions that you can answer.
Yeah,
Yeah.
I
Because
still
you're
don't
smart
know
on the IEP side and you're smart from the school and then you're smart from the medical side. I mean, that's a great you're like a jack of all trades in this area.
Yes. Yes.
Yeah, thanks. It's funny, but I said to myself, I said, I always want to go back and do this. And then I like, it was years of school. My husband said to me, you go to school one more time. I don't know if I can handle it.
I guess the
Um,
only thing you need to get is a law degree.
that's right.
Yeah, you're right.
I'm helping with trust funds and
Yes. Yes,
special
Yeah.
absolutely.
But no, I just applaud you, Aaron. I mean, and I will say, like I said, when I meet with Aaron, we're in there for over an hour. I mean, and we just laugh and talk about everything, not just the medical side, if you remember the last visit, but I really enjoyed, I mean, just
Mhm.
collaborating with Aaron. I love Dr. Crino. When I came in, he was so fun. I was thinking I was getting ready to get in there with this starchy man. When I say he was hilarious, this was a great team. I mean, when I say this is an awesome team, but Aaron, let me ask you this. Is that the only location that you guys have, even though I'll drive there? But are there other locations where parents can go other than Baltimore?
Dr. Crino also sees patients. Sometimes I don't see patients out there, but I do telehealth. He sees patients out at the Kernan Center in
Where's
Baltimore,
that?
near
It's
Woodlawn.
still in Baltimore. Okay.
So
Okay.
there are some patients that come out there. He has a very limited schedule out there, but he does see patients as of now out there. But
Yeah.
yeah, I wish we had more and more locations. I got
Yeah.
very lucky that I get to work with him because he's absolutely brilliant, absolutely amazing, and his heart. He has a heart of gold, and all he
You
wants
could
to
tell.
is do the best for patients with intellectual disability, autism, neurodevelopmental disorders. He has such a passion.
Is
Um,
he an older guy?
yeah, but you wouldn't know it.
But I want him to I want him to be around when Grayson turns 18 so I can transition him to his care.
Bunny, when I
Grayson's
say
only 7 right now, so that's why I asked,
Yeah,
Bunny, he was great. He's great.
yeah,
Yeah.
he's wonderful, and I think if he had it his way, he would have, comprehensive care to the point where he had a dental provider, he had lab work on site. If he could do
Mhm.
it and he had the money right now, I think that
Yeah.
we would want a huge center in Maryland.
Well, I
Um,
And
hope
we
he's
need him.
around when Grayson turns 18. I'm definitely going to look him up.
He's awesome. He is awesome. So I feel privileged to have, had them to oversee Morgan's care. And I was just like, Aaron, you all are great. It's like sitting there talking to friends. And I appreciate that because with all that the parents go through, we need sometimes that bright thing where you're sitting back, you're chilling. It's almost like I felt like they was gonna bring me in a snack and a meal.
and the funny part about it is we have like an office manager. She does all of our scheduling, all of our she's unbelievable. Her name's Michelle. And parents will say to
Yeah,
me, yeah, I call Michelle, and she just checked in on me. I'm like,
yeah,
what? She checked in on you? Like,
yeah.
they're like, yeah, she
It's
That is
called
awesome. It makes it worth your drive, Paula,
It
to
does.
drive that far. It's worth it.
It does. I told people when they say, "Well, we feel so bad because it's in Baltimore." I said, "I got a good working car. As
Yeah,
long as that person is worth me coming down, and I wouldn't want to go if they were rude and
yeah.
but they're not. I enjoy going to that clinic. And then when Morgan comes in and drops in the floor, everybody's like, "Hey, Morgan." The nursing staff, everybody's like, "Oh, you don't want to see us again today?" So I just really enjoy them, and I would recommend them to anyone. I really appreciate it. And Aaron, I just appreciate you coming on the show, taking your time away from Josh and your
Absolutely.
husband and coming on the show. This has been awesome. I mean, and now since I know that you are a jack of all trades, oh, you can forget it. I got your
Right.
email and stuff. I'm gonna wear you.
Yeah. Are you guys taking new patients?
We are taking new patients. And the clinical center does take new patients. However, they do have to have epilepsy. So that is part of the criteria. But they certainly can call the CCAND clinic. For short, we call it CCAND, CCAND Clinic at University of Maryland Medical Center, and medical school. I apologize. And you certainly can call and see if you meet the criteria to make an appointment.
Absolutely. Paula, you can put the information in the chat so
I
that if
will
there's
do.
anyone that meets that criteria, they can definitely call.
And we
Yes.
see adults. We don't see children, but
Hmm.
there's plenty of experts out there for pediatric patients in Maryland. Some of the lists are long, but there are plenty of providers that treat patients with epilepsy and autism. But there are very few providers for adults with autism and epilepsy. So that's what we do at our center. Yeah. So.
Yeah,
And I will say,
I need a new autistic provider that
mhm,
really specializes in autism.
Mhm.
mm. Well, I will say this. I appreciate you guys for joining us tonight. I also would like to just emphasize to all the parents, make sure, and I think we've said this several times before, when you are part of that team, make sure that you're a respected part of that team. Make sure that when you get with your providers, that they understand your role and they respect your role. And if at any given time you feel that you're not respected, that's not the doctor for your child. It's not the doctor for your adult. So I will just say that again, coming from a parent that have had to drop some doctors along the way, if I don't feel comfortable or if I don't feel like you respect me, then it's a done deal. So thanks again, Erin, for joining us. I really, really appreciate it. I enjoy talking to her in the offices, and that's why I always get visits at the end of the day.
Right. Well, I enjoyed being on the show, but the other
Yeah.
thing is to remember too, it's nice to be in a place where, people will say to me, "I'm sorry, he's pulling his hair out or he's doing." I'm like, I really don't care. I live this every day. Like, this is just another day in paradise for me. Like,
Yeah.
I see it at work, I see it at home, I used to see it in the classroom. I'm like, please do not worry about the fact that your adult child will not sit in a chair. I really could care less.
I know
Yeah,
we
Um,
Morgan
always
sit
apologizing. We always
right.
apologizing.
We
Morgan
are.
sits on the floor the whole time at the door, ready to go. So yeah.
Yeah, and you always have those providers or those people that, say, "Oh, you don't know how to control your child." I love that. Or you don't know what you're doing. I love that.
Yeah.
Walk a day
But
in
it's
my shoes and we'll see how you do.
how about
Absolutely.
that? I love it. I love it.
Absolutely. This has been great. Thank you so much, Aaron. I have learned so much. It was a pleasure meeting you and speaking with you. This has been amazing.
Yeah,
Yeah.
it was a pleasure coming on the show, and I appreciate it that you guys invited me, and it's been such a pleasure to get to know Paula, and I hope that you all keep in touch.
I sure will. All right, bye. Everybody have a wonderful weekend. Easter. Yeah, it's Easter this weekend. So everybody have a wonderful Easter and join us again next Thursday. Have a good evening.
Bye, everybody.
Bye.